Hi everyone. For my contemporary issue presentation, I chose to focus on the topic of universal healthcare. Civil rights is defined as personal rights guaranteed and protected by the United States Constitution and federal laws enacted by Congress. Civil rights laws prohibit discrimination on the basis of race, color, national origin, disability, age, religion, and sex. Um, so the human civil right of healthcare isn't defined as a civil right under the law. Some countries have healthcare as a civil right in the universal healthcare policies that they have, where they have a centralized healthcare system. These countries include ones like the UK, Canada, or Switzerland. So, universal health care coverage means that all people have access to the healthcare services they need when and where they need them without the financial hardships. It includes the full range of essential services, health promotion, prevention, treatment, rehabilitation, and some palliative care. Currently in the world, half the population does not receive the healthcare services that they need to live a daily life. About each year, 100 million people are pushed into extreme poverty due to out-of-cost medical spending. Good healthcare systems are rooted in their communities. I have the fortunate ability to work and serve my community up at the Lehigh Valley Hospital. I've been a nurse up there for the past 2 years. So good community hospitals focus on not only treating diseases and illnesses, but also the prevention and helping out the community as a whole to help improve the well-being and quality of life. One thing that isn't discussed often is that during the 1960s and 70s, civil rights organizations ranging from the Black Panthers to the NAACP made health access for African Americans a focus in their efforts of fighting healthcare segregated facilities and to help improve the cares of all individuals because still to this day, unfortunately, there are some disparities in the amount of access and high class premier facilities in different areas of wealth and poverty in the nation. So, one thing I wanted to look at here is that during COVID, it really opened the eyes of the United States healthcare system from the amount of severe cases, the amount of cases in general, the lacking of supplies, different shutdowns. It was a real eye-opener of how the healthcare system needs to change to better improve for future pandemics in the world and in general just improve the healthcare of communities and the nation in whole. So, working in the hospital during COVID, I experienced and treated patients, and the hours were very long, strenuous, and we each gave our all best we could to care for and treat each individual patient. Unfortunately, during this time, not all individuals were able to survive. Some cases, there were where individuals of the minority community died at much higher rates than ones of the white community, privileged community, one may say. This is something that needs to be addressed and looked at and investigated more to better serve the communities and the country in a whole. The coronavirus pandemic exposed the continued chiasm in health equality and equity in the United States, with, like I said, non-white communities suffering higher rates of infection, higher rates of mortality than the rates of the rest of the population. One thing that I can say from my personal background is that during admission questions and other assessments that I do as a nurse, Sometimes the people in a minority community and minority setting aren't able to get to the doctor as often as someone in a more privileged and white community, and this may be due to financial hardships, taking care of family members. They need to have different job requirements, and it's really puts in perspective of the lack of healthcare resources that are focused towards minority individuals and communities where they aren't able to get the same preventative treatments and the same access to medications, top class doctors and surgeons to be able to best live and support themselves and live a healthy life. So there's many pros and cons to a centralized system that provides healthcare to all individuals, no matter of race, background, sex, or any type of skin color. There's many pros and cons to this centralized healthcare system. So looking at the pros here, in 2016, the spending of the United States for healthcare costs rose by 4.3%. The average person in the United States at this point spend over $10,000 per year. Compare this to Canada, where a person only spent $4,752 in 2016, and in the UK, a person on average spent $4,192 per person. So the overall healthcare cost per person would be decreased with a centralized healthcare system through the government. And another pro for this is like looking at the bills that we get here in the United States. Each service and tests and appointment that you go to, you get a bill for each individual fee. You have your fee maybe when you go in before you even see the doctor. You have the fee for the nurse to draw your lab work. You have the fee to see the doctor, and then you have the fee for medications. And then many times it is very challenging when you get these bills after it goes through insurance as to which was for what test or which procedure. And it can be very cumbersome to get a hold of someone to have them better explain and evaluate why you're being charged the amount you are, and looking at how best to pay for these things. And also, the centralized healthcare system through the government would help reduce bankruptcies due to medical care. It would help take the burden off someone paying and being in debt $20,000 for a specific surgery that they needed to save their life. You shouldn't have to decide to save your life or put food on the table. It's very challenging in the system that we live in right now with the high costs of medical care. About 60% of Americans receive health insurance access from their private sector employee. That means the cost of the policy is shared between the employee and the business. Most employers, on average, spend $6,000 to $10,000 a year on a policy. Sometimes the costs of these can still be billed as an income to a worker, and in this situation, a employee is not taking home the amount they're paying to their policy, and they're not being able to budget in a way that is best for them in some cases. Looking at the cons here, and with the centralized healthcare system, they have been known to have wait times that are longer to get into specific specialists, and have specific tests in other countries is a big thing that needs to be addressed and looked at if the United States would look to do a centralized healthcare system. I think that with our system how it is a very large system throughout the United States, and with public and private healthcare systems, with the VA healthcare systems included. I think the amount of physicians and nurses and other healthcare professionals is very vast and large compared to other countries. We have top-notch doctors, facilities, and services that we provide here in the United States. and I think that the wait times can be addressed in an appropriate manner. Of course, that some taxes would have to be raised to offset the reduction of the healthcare premiums that are being paid through private employers, and companies, and there would be families making more money each year in the system instead of less, but also wealthier individuals would have to see to it that they support more sicker and poorer people, which in a system of capitalism, this would be a big change, and some people may see it as a state of socialism. One other large thing that's not listed here is that in healthcare, private insurance companies and pharmaceutical companies, they are able to set their own costs for their premiums, and also pharmaceutical companies are work together with insurance companies to set prices for their medications. They would have to, of course, in a centralized system with the government, cut back their amount of employees. They would lose revenue. They would have to work with the government to best come up with a system that would be best to serve all individuals in the United States. A plan that would focus on providing the same equitable care for each individual, from one who's making $0 to one who's making, a million, tens of millions, everything like that. So looking at this in this stance, it's a very touchy subject with insurance companies because they have a lot of pull, a lot of money. They're billion-dollar systems, and the government would have to figure out a way to best incorporate their ability to help serve individuals. It could be looked at in a way of Medicare, where they have Medicare, which is supplied through the federal government, but they also have supplement plans to help offset other additional costs in medication or specialty visits. Another thing with the costs maybe coming down in a system where the government sets specific price limits and other limits as to what they will pay in their system of medical insurance. The salaries may be reduced for medical professionals because at the end of the day, healthcare facilities and institutions are a business, and they still are trying to make money and survive and keep the lights on for individuals. So that would have to be looked at too, with the reduction of salaries. And then also in a centralized healthcare system, sometimes there's less competition in the state of that. Right now, if you look at a hospital in central Pennsylvania and the University of Pennsylvania, you would think that the University of Pennsylvania is much better, has higher class doctors, and could offer better services. But in a centralized system, they might have to more so distribute the services throughout the entire country. So one individual can be able to go to a community hospital and get the same world-class, top-notch, life-saving medical care than they would going to a city hospital like the University of Pennsylvania in Philadelphia. It'll be a debate for, I think, many years to come as to what is the best option for healthcare. I think that in the long run, and from my personal experience being in the hospital and seeing the burden that different operations, different medical procedures and medications are put onto people, that people really, they choose between taking their blood thinner or putting food on the table, or driving or putting gas in their car to go to work. It's something that is a touchy subject, and like I said, a debate that will continue for some time to come. On the next page here, I have my sources that I use for this presentation, and I appreciate you taking the time to view this, and I look forward to looking at additional civil rights presentations.